Hello, sir. My name is Daniel Ruiz. I'm a student physical therapist assistant student at the University of St. Francis. Can I go ahead and get your name and date of birth to confirm your identity?
Nate Van Kirk, 122904.
All right, Nate, that's my guy. I'm gonna go ahead and wash my hands here. All right, so Nate, from first of all, how are you feeling today? How would you rate your pain today coming in on a scale from 1 to 10? 1 being 0 to 10. 0 being no pain at all, and 10 being the worst pain you've ever felt.
Probably about 3.
3?
Yeah.
Okay, 3. So what I want to do today, Nate, is I want to work on some myofascial release to try to get that 3 maybe down a little bit.
Okay.
So I have a couple different methods I want to try, but before we do that, I have to clear a couple things first, okay?
Okay.
So you have no inflammation?
No.
No cancer? How about any infections? None on your back that you know of? How about circulatory problems?
No.
No aneurysms?
No.
No bruises anywhere, fractures? How about edema anywhere I should know about?
No.
Swelling? Okay. How about cellulitis?
No.
No. And you haven't had a fever? You haven't been feeling sick recently?
I'm good.
Okay, so I think we are good to go ahead. So what I'm gonna have you do is I'm gonna have you lay belly down on the table.
Okay.
And if it's okay with you, can you go ahead and show the skin on your back? Like
Yeah.
you could take off your shirt, or you could put it over your head, whatever you're more comfortable with.
Okay, I'll take
But
it.
I'm gonna need to see the whole back, okay?
Okay.
All right, so go ahead, take your shirt off and lay down, belly down. So this first one we're gonna do, I'm gonna be on the front side here. So this is called a skin roll. So I'm gonna put my hands right here, and I'm going to sort of kind of come along here and just glide across the skin. And let me know if this is at any point too uncomfortable. We're gonna try that one again. So I'm gonna try to get a bigger fold here. You can see his skin he's having that autonomic reaction where skin is already turning a bit red. There are a couple, I can feel a couple of adhesions. All right, I'll go ahead and do one more time. And that is turning a nice red color. So I do think you got some a bit of tightness going on back here. Make sure we try and get skin full there. Right here's a little extra tight. Let me know if this is painful at all, Nate.
Okay.
Okay. So call it there. How's everything feeling, Nate?
Feels good.
We have a nice pink color back here. So getting good blood flow to the area. For the next one, we're gonna do what is called a cross hand release. Okay, so I'm gonna do this on both sides of your lower back, okay, Nate?
Okay.
So I'm gonna place my hands like this, and I'm just going to push kind of apart here. I'm gonna go a little bit lower down, okay?
Okay.
So do this side here. Let me know if that's too uncomfortable.
Okay.
All right, go ahead and get your other side as well. Make sure nice and even. Go like this right here. And that coloration from the first one's kind of fading out nicely, but you can tell that he's got some adhesions in his upper back there. All right, how's that feeling, Nate?
Feels good.
Okay, come back around here. The next one, we're gonna do some muscle play. So I'm actually gonna have you flip over so you're gonna be belly up. So what I'm gonna do here is I'm gonna grab a hold of your trap. Don't freak out on me.
Okay.
And we're gonna move it around a bit, all right?
Okay.
So I'm gonna grab and feel here for the trap, palpate for the trap. Okay, got it. So I'm gonna move it up. Kind of hold that for a little bit. We know this is too uncomfortable, Nate.
Okay.
We're gonna pull it down. This side. Okay, so now what we're going to work on are some extremity pulls, okay?
Okay.
So I'm gonna go ahead and grab your arm here. I want you to go ahead and relax. Just relax for me. Awesome. Okay, so what I'm gonna do is I'm gonna distract, or I'm gonna basically pull on your arm, and then we're gonna take you through some range of motion, okay?
Okay.
All right, so I just want you to try and stay as relaxed as possible, all right? I got you. Nice distraction here. Let me know if anything is
Okay.
tweaking or uncomfortable. Alright, everything feels pretty good. We're gonna go ahead and stand on a leg as well. So kind of same thing, I'm gonna pull on it here. Make sure the pelvis is not moving too much. Just a light pull. We're just gonna take it through some range of motion here. Tight hamstrings. Yeah, that's crazy.
I haven't done anything today. I just sat down the whole day.
Me too. All right, so last thing we're gonna do an occipital release. So
Okay.
I'm gonna grab this stool really quick. Because when we do this, we will hold it for a while. So I'm gonna palpate the protuberance here. I'm gonna have you lift your head up here, just 1 second. Let me palpate for a second here. Make sure I'm on the occipital bone here. And I want you to just go ahead and relax and push your head down. All right, and I would just hold this for a while when we were, if we were actually doing this with patient. I would do this for quite a bit of time. But we're gonna go ahead and call this good. So I'm gonna have you sit up, Nate.
Okay.
And make sure to help you up as well.
Thank you.
Okay. So Nate, how's the pain feeling today after some myofascial release?
A lot better.
A lot better?
Yeah.
How would you rate it on a scale of 1 to 10?
Probably 1.
A 1? Okay, so I'm gonna wash my hands and I'm gonna document that. Write down that we got it down to a 1. That's awesome. And I hope you have a good rest of your day.
You too.